stakeholders and the groups that represent Tennessee's population. So to discuss a little bit about the plan, we'll talk about our allocation phases. So this is how, when we don't have enough vaccine to hit all of the general population in Tennessee, how do we best allocate our limited doses? And so like I said, we base this off of NASEM's guidance, and then we'll also take into consideration ACIP's recommendations as they come out. And so earlier this week, ACIP did actually release some recommendations for the phase 1A population. And so if you see on this slide, we have some numbers in white and some numbers in red. These numbers in red are what's really been changed with this most recent update to our plan that was put on the website on Wednesday. And just to reiterate, this is a working document, so definitely come back and check it out every now and then because it will change as we learn more about the vaccine and ACIP recommendations. And so we took what was previously our phase 1A, phase 1B, and phase 1C, and we collapsed those down into phase 1A1, phase 1A2, and phase 1B. So our phase 1A1 is inpatient and other high-exposure healthcare workers, residents and staff of long-term care facilities, and first responders. When we go down to our phase 1A2, that encompasses all other healthcare workers, and then our phase 1B are persons with high-risk comorbidities. Looking at past phase 1 into phase 2, we have our critical infrastructure, school and child care staff, moderate risk comorbidities, and persons aged 65 years and older, congregate care and corrections. We then go on to young adults and children if we have a vaccine by that time for children. Currently we do not. And then all others in phase 4. Again, this is very much subject to change as we learn more about ACIP's recommendations. To talk a little bit about vaccine safety, one very important note is that through this, this Operation Warp Speed and the process to get vaccines out quickly for this pandemic, we did not in any way compromise on the safety of the vaccine. We went through all 3 of the clinical trials or phases in clinical trials to assure safety. And so in a normal life of a vaccine coming to market, you go through the phase 1, 2, and 3 in clinical trials, and then once a vaccine has passed all of those, you go into the manufacturing stage. So that's when you have to get buy-in and get money to, create manufacturing centers, get raw materials, staffing. It takes a lot of time, years even, to get through this stage. And so how we actually cut down the time for getting this vaccine through the FDA approval, EUA approval process is that instead of doing this in a stepwise function, we did it concurrently. So as these manufacturers are going through the phase 1 through 3 clinical trials, they're also doing the manufacturing. And this is because Operation Warp Speed was able to put money into that. So we're funding the vaccine candidates prior to knowing their outcome. And so does that mean that we could potentially put money into a vaccine that doesn't make it through the 3 phases? Yes, it does. But that also means that we get it out quicker. Another note on vaccine safety is that we have very robust safety systems to monitor after we get through the clinical trials and into general population. And so one that is specific, and I'm going to highlight today, to COVID-19 vaccine is this vSafe application. And so this is a text messaging platform that recipients of the vaccine can sign up for at the time they receive their dose. And it'll send text messages to the recipient to check on their health status for a certain time after receiving the vaccine to make sure that no side effects happen. So this is in addition to 4 other systems that we have ongoing that are utilized for other vaccines as well, such as VAERS, which is our vaccine adverse event reporting system. Vaccine Safety Data Link, our Clinical Immunization Safety Assessment Project, and National Healthcare Safety Network. So one thing I do want to emphasize is, as providers, as you're giving doses of COVID-19 vaccine, please make a strong recommendation, not just for the vaccine, but also for patients to enroll in this Be Safe application. It'll be the quickest way that we'll hear of any signals or see any signals, if there are any, to come up. And this is an active surveillance monitoring system, which is really important. We'll talk a little bit about the vaccines that are currently in clinical trials. The two at the top, the Pfizer and the Moderna, are in green because they're in, they've submitted EUA applications to FDA. And so I will quickly go over all of these, but I'll go more in depth on those two. So we have our Pfizer-BioNTech vaccine. That's an mRNA vaccine. It's 21 days in between doses, and it's in ultra-cold storage, which is at -70 degrees. We have the Moderna vaccine, which is actually 28 days in between those doses. It's frozen at -20 degrees. Going into those that aren't quite as far along into the clinical phase process, we have our AstraZeneca vaccine. It's a replication defective vector. There's 28 days in between doses, and it is a chimpanzee adenovirus vector that causes the production of the spike protein from COVID-19, the SARS-CoV-2 virus, and that's actually, that spike protein is what is encoded for in the mRNA vaccines as well. We have our Johnson & Johnson vaccine. It's a single dose, but it also has a 2-dose regimen in a study currently. It's also an adenovirus vector, and it's a frozen vaccine at -20. We have our Novavax. It's an adjuvanted protein subunit vaccine, and so it's a small portion of a protein that's used along with something called an adjuvant that kind of kickstarts your immune system so that it can recognize that protein subunit. There's 21 days in between doses, and it is a refrigerated vaccine. Lastly, we have our Sanofi GlaxoSmithKline. Again, this is an adjuvanted protein subunit vaccine, and it's similar to our Flublok influenza vaccine. Going a little deeper into Pfizer, has shown great efficacy, 95% effective in preventing COVID-19 7 days after dose 2. It's been tested in over 40,000 individuals, and there have seen no significant adverse events. Tennessee itself is anticipating over 56,000 doses on or around December 18th. This is 58 boxes of 975 doses, and these will be shipped directly from Pfizer to the vaccinating facilities. This is stored in ultra-cold freezers at -70 degrees, which is a little bit of logistical gymnastics for us to figure out how to do that. And so one of the ways is that it's maintained in a shipper that's provided by Pfizer for up to 14 days with the dry ice recharge 3 times within those 14 days. Ancillary kits are also provided. These include needles, syringes, PPE, saline diluent, alcohol swabs, and patient cards. These are reminder cards so they know when to come back and get their second dose and what vaccine they had, because what vaccine you start with is the one you have to finish with. There's 21 days in between doses. We've allocated this to 27 hospitals, and these hospitals have over 1,400 phase 1A population. We manually allocated these to minimize wastage, and this will be used to vaccinate hospital workers. Going on to Moderna. Moderna is about a week behind Pfizer in getting to market. So we have that one that we're expecting about a week after Pfizer. It's 94.5% effective in preventing COVID-19 7 days after dose 2. It's been tested in over 30,000 individuals. And we're anticipating around 100,000 doses on or around December 22nd. Again, this is subject to change as we learn more about our allocation. And this is actually shipped from the McKesson warehouse. This is frozen storage at -20 degrees. The ancillary kits for these will include needles, syringes, PPE, alcohol swabs, patient cards as well. Again, no gloves in this. There are 28 days between doses, and this is allocated to approved facilities based on a specific formula. This formula is that 5% of these vaccines will be retained by the state, 100 doses will be allocated to each of the county health departments, and then the rest of the vaccine will be allocated across the 95 counties based upon county population and distributed across these approved facilities. The use for this will be to also vaccinate hospital workers and then first responders, long-term care staff, and others through health departments, points of distribution, strike teams, and pharmacies. A little bit about how this vaccine is allocated and distributed. So as a state, CDC tells Tennessee how many vaccines they will be allocated, and then the state then allocates to counties and facilities based on predetermined criteria. So we take this allocation and we order that specific amount from CDC for each facility. For Pfizer, this vaccine will be shipped from Pfizer and sent directly to the facility. However, for Moderna and other vaccine types, CDC will place an order, and then it will go from McKesson, which is their distributor, to the facility. This is just a look at the approved providers that we have in each county within Tennessee. We have currently 210 providers that are able to receive vaccine at this time. That doesn't mean 210 providers are receiving vaccines, but these are the ones that have gone through our process and have approved provider agreements and are ready to go in the system. This is where our first Pfizer allocations will be going. Again, we expect these to arrive around December 18th, and there'll be boxes in 11 counties and 27 hospitals. A little bit about the timeline for Pfizer vaccine. So day 0 is the day that vaccine arrives to the facility, and so one day before that, the state will put an order in with CDC, and that vaccine will ship from Pfizer directly to the hospital. On day 0, the hospital will, of course, receive that vaccine and ancillary kits. Important to note that while the vaccine for the Pfizer vaccine is coming directly from the manufacturer, the ancillary kits will be coming from McKesson. The hospital will accept the order, and then they will have to do a dry ice recharge if they are not putting the vaccine into an ultra cold freezer. From days 1 to 14, providers will vaccinate their phase 1A population. They will recharge dry ice at days 15 and day 10, and they'll do daily reporting of their inventory and the doses given into TENNIS, our immunization registry. From days 15 to 20, it can be refrigerated. Again, we'll go through vaccinating that phase 1A population and then doing daily reporting. On day 18, from the initial receipt, the state will order the second dose allocation. And the vaccine will ship from Pfizer to the hospital to arrive on day 19. The vaccine is received by the hospital again, along with ancillary kits. The order needs to be accepted like before, and then a dry ice recharge, and then that process is repeated as it was from day 0 to day 20. For Moderna, this is a little different. The state will order the vaccine, and the vaccine ships from McKesson, which is the distributor, to the site. Again, on day 0, when the facility receives that vaccine, they will need to accept that order, and then they can vaccinate from days 1 to 28, again, doing that daily reporting. This vaccine can be stored in the freezer and then also in the refrigerator for up to 30 days. There's 28 days in between doses for the McKesson vaccine, or I'm sorry, for the Moderna vaccine. So on day 26, the state will order that second dose, and the vaccine will arrive to the facility on day 27, and then that administration cycle will repeat. So we went through a lot today. So there's a bunch of resources on our website. You can get to it the same place that you did the vaccine plan, but there's also an additional site. So if you click on that little gold banner at the top of the website at tn.gov/health. It'll take you again to those icons. You can again follow it to that COVID-19 vaccine information icon, and you can also go to that healthcare provider and laboratory icon where there's additional information on how to become a pandemic vaccinating provider, how to complete the provider agreement through our REDCap survey, and then, of course, FAQs on that as well. Please regularly check back as we're actively adding more and more information to both of these sites to help you in the process. All right, and with that, we have a whole team here to help answer your questions. All right, our first question is, if someone has COVID, do they still get the vaccine if they fall into the group? So yes, we are not doing any kind of pre-screening for someone who has had COVID-19. If they have had, you know, the disease, they are still eligible to receive the vaccine. Where do pharmacists fit into this distribution? They'll fit in with other healthcare workers to receive that vaccine. So that's phased. I'll go back to our phasing system really quick. There we go, phase 1A2. Will Moderna go to pharmacies, or is it just for pharmacy staff? I think that's a good question that we may not have a full answer to, because as more vaccines become available, we're not going to be able to tell what specific vaccine will go to each facility site. As of right now, we're not expecting Pfizer unless through the federal pharmacy program. Even then, I don't think we're expecting any Pfizer to go to pharmacies.
How are you able to see if you have been approved as a vaccination site? You will receive a welcome email from the tennis team that'll let you know who your contacts are, so you will know what your PIN numbers are, and so you'll get an email saying these are your contacts, these are the emails that you'll be receiving information on regarding allocations. So you will receive an email, and it's really important that when you do get that email that you make sure that the contacts that are listed on there are still part of your facility and that the email address and phone numbers associated with them are correct, because that is where you will be getting information regarding shipping.
Currently, Pfizer is going to hospitals because of the logistics around having an ultra-cold vaccine. It's a little bit, not just the ultra-cold vaccine, but even more importantly, because each of the Pfizer shipments has 975 doses, and that's really hard to find a population big enough to receive that, especially when you factor in the fact that not every person that's offered the vaccine will receive it. So one of the reasons why Pfizer is specifically going to hospitals is because we need to find a population big enough to support that 975 doses. Information on how quickly the vaccine is effective after receiving, that's a really good question. So we do know that both doses are needed to have a robust immune response, and it looks like potentially 2 weeks out after that second dose, we could be seeing a good amount of effectiveness, and so that would be about 6 weeks after the second dose from Moderna and about 5 weeks out for Pfizer. Good question about enrolling in a vaccine trial, especially if you're a special population. I recommend going to the FDA website and seeing where clinical trials are located. Good question about if we allow bulk uploads of applications for providers with multiple locations. Please feel free to reach out to our email address for that question, and we can work alongside you to get that happen. So our email address, we can put it in the chat, is vpdip.pandemic@tn.gov. We have a question asking about antibody-dependent enhancement in COVID-19 with regards to vaccination and if there are concerns surrounding that. And I know this is something that's been looked into during these safety trials and by the researchers. I don't know that I've heard of any kind of concern come out from that, but I do know that that's something that's been definitely looked into for this and probably ongoing.
So do university student health center workers who are actively testing for COVID-19 fall under high exposure healthcare workers or other healthcare workers? They fall under the phase 1A1, so yes, they would fall under the high risk healthcare workers.
So as far as we are aware, we do have a question asking about allocation numbers and if they've been reduced. As far as we are aware, this 56,000 number that we have is our final number for the allocation, our first allocation. However, of course, things are subject to change from CDC, but as far as we know, that is our final number currently.
And it has nothing to do with cold chain issues. It's just the available doses at this time, so.
We have a question about becoming a pandemic provider for long-term care facilities and hospice chains. So this is something that has two answers to this question, potentially three. One is that CDC has a pharmacy partnership program in which some long-term care facilities could have signed up for, and unfortunately that enrollment period is over, but some long-term care facilities are covered under that partnership program where pharmacies will go in and vaccinate their residents and staff members. Another way is that if the facility is large enough to handle a Moderna, allocation of 100 doses, we can definitely enroll the facility as a pandemic provider, and that's something that you can look into on our website. And find that enrollment packet. And then also, if it's a smaller facility, we can definitely work alongside the local health department to get vaccine to that population.
Does the system guarantee those that get the first dose also get the second of the same vaccine? Yes. The doses that we're getting, automatically we're holding back the same amount for the second dose to ensure that everyone that receives the first dose of Pfizer will be able to get the second dose. We're also making sure that when you do get the first dose, that it's being recorded in TENIS, which is our immunization information system, so that we know which dose that you got the first time, so that we ensure that you do get the same dose the second time. You also will get a reminder card when you get the first one, so that you will know what you did receive, and you should be getting an appointment scheduled for the second dose, or told if there's going to be another event happening, so that you are getting the same dose. So yes, we are putting things in place to ensure that everybody gets the second dose on time and that you are getting the same vaccine.
We have a question if VSafe, the text application, will recall or remind patients for their second dose. I'm not aware of that functionality, although that's a really great recommendation for that functionality or for that application. But I'm not aware of that functionality within it. We will, at the state, have a recall system or a reminder system where we remind patients about their second dose, but we also encourage facilities to remind their staff members when to get that second dose as well. Assisted living facilities are defined as long-term care facilities. So we have a question about how to best prioritize populations, and we have recommendations for that in the pandemic plan, and it will also more than likely be population and facility specific as well. But there are recommendations for prioritization in the pandemic plan.
As a follow-up, our hospice covers 13 counties and 6 offices. We don't have an application in for allocation directly to us. Should we try to get one or just go through current distribution channels? I guess it depends on how many people that you would think that you are able to vaccinate and how much vaccine you would use if you think that you would want to enroll. But otherwise, I would reach out to your local health department to see about getting your staff vaccinated, or your HCA, to see if they're going to be having any events in your areas that your staff could go to get vaccinated. That's what I would do at this time.
So I see a note in here that data from the UK release of Pfizer product this week stated that the vaccine would be good for 30 days on dry ice. We are bound by what Pfizer gives us within the EUA and submits to FDA for approval process, and that currently is 14 days or 15 days on dry ice and then 5 days in the refrigerator. So that will be currently, for at least for this first allocation, how it has to be handled. Yes, outpatient physicians are in group A1, 2. Currently, that does mean our local health departments are not receiving Pfizer. I'll never say never in getting Pfizer, but that is our current plan, is that Pfizer is going to hospitals, and at the current time, local health departments will be receiving Moderna, but that is subject to change, as mostly everything we're saying right now is. Yes, facilities can bill an administration cost for the vaccine. However, if a patient is not able to pay that fee, the provider cannot charge it, and that's outlined in the provider agreement. We do know that there will, that our initial Pfizer allocation for December 18th will have a second allocation 2 weeks after that we can do for the second dose, and after that, I believe that's all we'll be receiving for this year. currently do not know if the EUA information will be released early. I have not heard that it will be, but do understand that that creates a lot of logistical hula hoops to jump through for EHRs. But I am not aware currently that the EUA information will be released early. We'll look into that and verify.
And that, if I jump in here, we do know from an EHR perspective, we do know what the required data elements are that need to be reported. So that is known, if that is what the question goes to. No?
Did you get to know if they can bill patients' insurance?
Yeah.
I was just reading that one. Is that any guidance?
There is a question about what is the grace period around the 21 days for the Pfizer vaccine, and it's 3 days both ways, so 18 to 24 days. When the training tutorials will be released for the vaccine, so Tennessee is creating specific educational materials that will be released next week and sent out to all approved providers and then also put on our website. CDC is also developing great training materials that you can find on their website as well. There will be an EUA fact sheet in lieu of the vaccine VIS. Since it's not going through the full FDI approval process, it won't have a vaccine information statement, but much like the VIS, we will have an EUA fact sheet that needs to be given out to every patient who receives the vaccine. Sorry, we're watching as other questions roll in. One of the questions is, will vaccine go directly to University Student Health Centers? That depends on if the University Health Center is a pandemic provider. So you have to enroll to be a pandemic provider to receive any vaccine. And so if not, feel free to look on our website on how to apply to be a pandemic provider. And you can also receive vaccines through the local health staff as well, local health department as well.
So are there any timing concerns with COVID vaccine administration and any other vaccines? So are there any timing concerns with COVID vaccine administration and any other vaccines? It looks like the ACIP states, with few exceptions, any inactivated vaccine can be administered simultaneously at any time before or after another inactivated vaccine. So as long as you're not giving live virus vaccines with it, you should be fine.
We have another question about a VIS. No, a VIS will not be available at the time of vaccine administration. In lieu of that, there will be an EUA fact sheet that will function as the VIS. Current contraindications, so this vaccine is currently not recommended for pregnant women as it's not been in clinical trials for that yet, and it currently only goes down to a patient population of age 16.
So is a consent required for individuals to sign to receive the vaccine? No, a consent is not required.
So we have a question, and I'm not necessarily, I hope I'm answering this correctly. If not, please feel free to write in and clarify for me. For approved pharmacy providers, is it anticipated to only go to CVS Walgreens, or will approved independent pharmacy providers be included? So the federal pharmacy partnership is just with, for long-term care facilities, is just with CVS and Walgreens. However, if you have a relationship with a long-term care facility and they would like to utilize you for vaccines, their vaccination events, please feel free to apply to be a pandemic provider and shoot us an email to let us know that you're working with a long-term care facility. Again, you can find the application to become a pandemic provider, which really is just the provider agreement. I use those terms interchangeably, but it's really just completing the CDC provider agreement on our website. We do ask, there are two ways to complete it. We do strongly recommend that you complete it through our survey. It's in a system called REDCap. We highly recommend applying through that way, but there is also a paper PDF version. It expedites the process if you send it in electronically through REDCap. Smaller hospitals will be receiving the Moderna vaccine.
Is there any reason to choose one vaccine over another for a patient population? For example, we have a breastfeeding mother calling and asking which one they should get. So far, breastfeeding women are not included in these COVID-19 clinical trials, same as pregnant women aren't, so we don't have advice on choosing one over another at this time.
Should pediatric practices register to become a COVID-19 provider? Great question. So I'm going to split this up into two different answers again. So there's two reasons to become a pandemic vaccinating provider. One is, of course, to, in these earlier phases, is to administer vaccine to staff. And then the second one is also to, once we get to later phases and have more vaccine available, is to administer vaccine to your patient population. Of course, we don't have a vaccine currently for any person's age 0 to 6 or 15 years of age, but we can still provide vaccine for parents, which is absolutely a great way to get vaccine into your patient's parents population as well. So yes, if you feel like you want to administer the COVID-19 vaccine at any point in time, please feel free to register as a COVID-19 vaccinating provider. Primary care falls into 1A2, which is all of your healthcare workers. Question, do you know the number of vaccines we're expected to receive? Currently from CDC for Pfizer, we're expected to receive a little over 56,000 vaccines, so it's 56,550 is that number.
Is there any plan to do family of healthcare workers that we live with sooner, or just do they fall where it falls in risk group? So for family members of healthcare workers, they would get vaccinated in whichever phase that they fall into.
Can small regional pharmacy chains go ahead and complete the provider agreement even if they might not be needed during phase 1? Yes, absolutely. We highly recommend going ahead and getting the application in so you'll be ready to go when we have the vaccine ready for you. Oh, let me see, there's a second part of that question. Even if they are partnered federally with their PSAO, I'm not quite sure what a PSAO is for phase 2, but I will say if you already have an agreement with the federal government, you do not need an agreement with Tennessee.
They still need to own
No. We have a question in, if we apply to become a pandemic vaccinating provider, are we guaranteed to get vaccine? That depends on what phase we're in and how much vaccine is available. So not every provider will be guaranteeing vaccine in the early phases. It depends on the patient population. So we have a question about anticipated timeline for the phases, and I think this is a very nuanced question, or nuanced answer, I guess, in that there's a lot dependent on that timeline, and that is with the ACIP recommendations. So, of course, we just received the ACIP recommendations for phase 1A, but there will be additional recommendations for each of the subsequent phases, and that will definitely have an impact on the timeline, as well as how we receive that vaccine and the allocations from the federal government. So that's really hard to say at this point in time. We have a question regarding on when to sign up to be a pandemic provider if you're a pharmacy and want to vaccinate your own staff. That depends on the size of your staff. So as you know, our allocations currently are $9.75 per shipment and $100 per shipment. So if your pharmacy doesn't have that many staff members, it'll be more than likely going to a health department or having some kind of local health administer the vaccine. But we do recommend, if you do feel like you want to become a pandemic vaccinating provider, please, as soon as possible and as early as possible, go ahead and apply to become one. One caveat to that is we are working through the applications to mirror our phases. So right now we're onboarding hospitals. And so if you do submit an application to become a pandemic vaccinating provider, it may be a little bit of time before we reach out to you, but rest assured we do have your information and we will reach out as soon as possible.
Yeah, there's a lot of questions about getting healthcare workers and other facilities that aren't hospitals vaccinated, and so I would reach out to your health department to see about getting those staff vaccinated if you're not going to be receiving vaccine.
If you're in Group 1A1.
Right.
If you're in Group 1A1. Question about how are you able to tell if you've been approved as a vaccination site. You'll receive, to the point of contact that you listed on your application, a welcome email. All right. We're waiting on a few more questions to roll in. I will make a caveat again that our vaccination plan is definitely a working document. It's subject to change, so definitely, check back often to our website. It's dependent upon many things, including the ACIP recommendations for allocation phases, and so things are subject to change. This is how it is right now on December 4th. It may be different on December 8th. Who knows? So please make sure to check back frequently to look for updates. So the definitions of high risk and moderate risk comorbidities can be found in our vaccination plan, but I'll give a list, but not promising that it's completely inclusive. But diabetes, COPD, cancer, we're pulling it up now. Cancer, chronic kidney disease, COPD, solid organ transplant, obesity, serious cardiac disease, sickle cell disease, and diabetes, and then those aged greater than 65 years. All right, looks like we have just a few minutes left. We're waiting for any more questions come in. All right, we'll give it just another few seconds to see if we get any more questions in. I have a question about a hospital that has been in contact with one of our public health strike teams and what vaccine would be brought. That would be Moderna vaccine as of now. A good question about how will we know when the state moves to the next phase. So we will keep up to date on our website about where we are in the process of vaccinating through the phases, but this also may be dependent on regional areas as well, not just across the state. I think that brings up a good point of, and I think I've said this a couple of times, but I've talked a lot about the plan. Make sure to just check for the website too. We'll continually update information. I think that's a great place to go for your first stop shop to find new information and about what's going on with the state of vaccine distribution in Tennessee. Sorry, there will not be any discussion of CDC quarantine guideline changes today. So the REDCap survey completed to receive flu vaccine is different than the survey for the pandemic vaccine provider, but if you did both, we can bring that information over for your storage and handling. Just let us know that you did both surveys and we can pull that over. All right, just a couple more minutes, waiting on any additional questions. Yes, you do still have to wear a mask after getting a vaccine. As we know, it's not 100% effective, only 94.5 and 95% for both of these vaccine candidates. And then also, it takes a little while to get that immunity in. So that's one thing that's important about this vaccine and getting that out into the population is that does not negate any of the social distancing and other non-pharmaceutical interventions that we're doing currently, such as mask wearing. All right. Seeing no more questions? Seeing one more question? We'll let this be our last one. Looks like we're right at 1 o'clock. Is the vaccine an annual vaccine? Great question. We're not sure yet. We'll learn as time tells with our current population that received the vaccine in the clinical trials. As more time elapses since the receipt of the vaccine, we'll know how frequently this vaccine will need to be delivered. Great question. All right, so given that, and it's 1 o'clock, thank you all for joining, and we will see you next time. Have a great day.